Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Thank you for having us today. Now, let's just jump right into it. Now, last week, both you and your wife would have taken the Sputnik V vaccine. Can you share your experience with us? Did you have any side effects?
Well, I personally did not have any side effects. I had slight pain on the site where I took the vaccine, but other than that, I didn't experience any headache or fever or chills or anything of the sort. And my wife did not have any side effects as well. So I guess, as you know, different people would react differently to vaccines. While we did not have any side effects, there might be other people who would experience these side effects. But most of these side effects that people would normally get is basically a reaction that one would expect. From the vaccines that we have given so far and the monitoring that we have done, people would complain about a little bit of fever, some chills, some would get pain at the site of the injection and so forth. And these are all things that one would expect when you get a vaccine. So it's not unusual.
Okay, Minister. Now, I know over the weekend the Ministry of Health would have continued its vaccination campaign at sites set up at religious organizations and NGOs. And I know you yourself would have visited some of those sites. What was the experience like interacting with persons who are waiting to be vaccinated?
I think a lot of people were happy to be able to get their vaccine, and what the ministry is trying to do. We are trying to get as much people vaccinated as quickly as possible, and we are doing that by having fixed sites where people during the week they know where to go. So for example, here in Brickdam there's a fixed site that is constantly open. People can come here and get their vaccination. And then we have, in between those fixed sites that we have around the country, we also have mobile sites, or pop-up sites if you like, where organizations within the community, so whether it's religious or civic organizations who want to partner with the ministry, they would come in, they would make a request, we would work with them, set a date, set a time, get staff to go out, and we'll be able to do the vaccination in the community. So generally they would use public facilities within the community that is quite accessible, and so we are able to get more people immunized within the heart of the community. And that's a good thing because we've gotten very good response in this way. So some people traditionally don't like coming to health centers, so in this way having a site that is more accessible and where people can feel comfortable coming, that's a good thing. We continue to work with a number of the NDCs because, as you know, the NDCs are the local governance structures, and we have spoken to almost all the NDCs, and we have had a very good reception from them, and we are working with them to schedule when we can come to their NDC or different parts of the NDC to be able to offer vaccination. So I think the response have generally been good, especially during the week. We noticed that on the weekends we normally have a drop-off where a lot of people don't come out on weekends. But nevertheless, we still try to maintain a service over the weekend. As of yesterday, we have been able to complete at least 60,172 persons receiving their first dose of their vaccine. And I think that's a good number.
Okay, Minister. Now, I know you said it would be 60,100, but do you have a breakdown per region?
We do. I just don't have it with me right now.
Okay, Minister. I want to speak to you a little bit on long COVID, also called post-COVID syndrome. It's shaping up to be a major long-term public health issue. According to a CNN article, in the UK alone, almost 700,000 people have reported symptoms for at least 3 months after getting infected with the disease. according to a survey done by the UK Office for National Statistics in March. Are there any plans to conduct a similar assessment here?
Well, we don't need to have a study per se to determine whether or not we have long COVID. What we do know is that persons who have been hospitalized, a percentage of them having been discharged would continue to exhibit symptoms and signs in different ways, depending on which organs or systems were mostly affected. So, as with any patient that comes to any one of our hospitals, once you've been hospitalized, you will receive a clinic card. You would, if we believe that you need to be followed up, you will receive on discharge a card to come back to clinic so that a follow-up can be done. In cases where they believe that, people can go without any such card, even if the person go home and after maybe a couple of weeks they feel that they're getting whatever signs or symptoms, they can always come back to one of the hospitals or clinic so that we can check. And it's very important for patients who would have recovered from COVID, if they're coming back within a short period of time to the hospital, to explain to the doctor that they had COVID in the past, so that that history is known, because sometimes people tend to ignore some of these things, which are very important. Now, long COVID, this has been a phenomena that was detected several months ago, and the doctors here have been able to read the literature, understand the signs and symptoms of long COVID, and have been treating people accordingly. So with the cases that we see popping up, we are able to administer the relevant treatment. And mostly the signs and symptoms that we're seeing, in some cases we've had younger patients that presented with cardiac symptoms, and they've been able to treat those persons. In other cases, maybe symptoms of the kidney, where they're having difficulty, and again, they've been able to treat those patients and would continue to treat them. We have also noticed that some people who would have recovered from COVID, they continue to exhibit things like hallucinations and other difficulties. And again, once they have these things, we'll continue to work with them. So we don't have to get a special study to work with patients who probably would have exhibited signs of long COVID. All we need to do is for them to come to the hospital, and we'll treat them accordingly.
Okay, so in essence, our surveillance team is actively following up on patients with COVID-19 that have had COVID-19?
We know those who have recovered, and if we detect that persons who have recovered have exhibited long COVID, we can probably put those stats together. But as of now, we are not collecting the details on that.
Okay, Minister, thank you for that. Now I have some questions from the Guyana Chronicle. They're asking if Guyana is going to donate any of its COVID-19 vaccines to St. Vincent to help with the evacuation of citizens, since vaccinated persons are allowed to evacuate to other islands.
First of all, I'm not aware that any request was made of Guyana for such assistance. But if any request is made, we'll certainly, the task force would certainly consider it.
Okay, Minister. Now, they're also asking if Guyana is still using remdesivir and convalescent plasma to treat COVID-19 patients, and if yes, how successful has this been?
Again, yes, we have, as part of our management of hospitalized patients, we have been using remdesivir for some patients meeting certain specific criteria. Remdesivir would reduce the length of stay in hospital. So we have remdesivir. It's available to those categories of patients, and the doctors who are managing them would normally make those calls. In terms of convalescent plasma, there is evidence that persons who have recovered would normally have antibodies in their plasma, and if you harvest that and give it to a patient who need that type of assistance, then it can help. And so we continue to use convalescent plasma for very sick patients at the hospital.
Okay, Minister, thank you. Now, before we go, I know the second shipment of vaccines is expected to arrive today. Can we get a comment from you on this?
Well, the second shipment of the Sputnik vaccine.
Sputnik vaccine, yes.
Right. So we received the first 25,000, and today we are expecting 30,000 more. As you know, the vaccines, we have to maintain a very cold temperature, which is -18 to -20. So we have put all the arrangements in place to make sure that when we receive the vaccine, that we maintain that cold chain until it arrives at a bond where it can be stored properly. And then, of course, as we distribute and we vaccinate people. So that definitely is in place, and we are very happy that we're able to get an additional 30,000 vaccines. Right now, as I said before, we have immunized about 60,172 persons, and we'll continue rolling out this week. With these additional vaccines, we intend to ramp up how we are to get more people immunized. And definitely because, you know, we have now have some proficiency in the use of Sputnik, because our staff was not accustomed to using vaccines that were, you know, at -18, -20. So we had to do special training with them. I think they're now more acquainted, having used the vaccine over the last week. They're now be able to roll that out in a faster way during this week.
Okay, Minister, I also know you would have mentioned that the government would have been exploring other avenues for vaccine procurement. Can you tell us how that has been going?
Well, we still are exploring. Last week we had some discussions with Johnson & Johnson to explore the possibility of accessing vaccine from that particular company. So we are still engaged in talks with different manufacturers of vaccine, and as those talks mature, we'll let the public know.
Okay, Minister, thank you for that, and thank you so much for your time today. This has been DPI's COVID-19 update. For more information, visit our website, dpi.gov.gy, or our social media platforms.